We're talking about one of the most surprising, even controversial things you can do to prevent the cancers that you fear most. I'm talking about taking the pill, the birth control pill. The question is, which one is right for you? And no matter what your age, when would it make sense to start taking it? And how long do you need to take it? Dr. Carolyn Westoff and Dr. Judith Wolf are both back with us. Birth control pills prevent ovarian, endometrial, and colorectal cancers. We have clarified why that is. We talked about how significant a benefit, and we both agree that it's about a 50% reduction in ovarian cancer and uterine cancers. Am I on target? Yeah. All right, so Dr. Wolf, talk to me about some other benefits as well.
Well, obviously birth control is a very effective method of birth control, but for many women, early in their period life and later on have irregular or heavy periods, and the birth control pill regulates those cycles, makes them lighter, and less anemia, less symptoms from the periods, less cramping. Some of the birth control pills also decrease acne and decrease mood swings that may be related to either perimenopause or premenstrual symptoms. And so there's lots of benefits for women to take the pill.
And so there are dozens of different types of pills, lots of products out there. If you want to prevent cancer of the uterus, ovaries, and colon, then you can take a traditional birth control pill. One that contains this constant level of estrogen and progesterone. So that's something that is all pretty easy to figure out, remember, and understand. So Dr. Westoff, you know, we talked a little bit about a duration that's required. I'm surprised that even a few years can give you lifelong benefit.
Right. The benefit kicks in pretty early. It's been detected in studies even with a year or two of the pill you get a benefit, but the substantial benefits come with 5 years or more of use. 5 years
at any time in your life?
At any time.
So if you've got perimenopausal symptoms at age 45, and you go on the pill for 5 years until you enter menopause, you'd still have a benefit for the rest of your life.
I think that's a great idea. And the women in that age group may benefit also because of the irregular periods. They may start losing bone in that age group, and the pill will prevent bone loss for women in their 40s, so that's another benefit.
And they also have now the extended cycle pills, right, that you all heard about. They stop your period for months at a time. Dr. Wolf, is there any thoughts about this? Any dangers to not having a menstruation cycle for 5 years in a row?
No, absolutely not. There does not seem to be any danger in that. In fact, there still may be benefit of that symptom-wise and anemia-wise. And the only detriment of not having your period is if it was something like you went through a premature menopause. If a woman goes through menopause before the age of 40, the things like bone loss, vasomotor symptoms, hot flashes, vaginal dryness, that's detrimental. But if it's because you're on a pill that's stopping the growth of the lining of the uterus and you're not having a period, there's nothing dangerous about that at all.
Okay. Dr. Westoff, what about the IUD? The medicated IUDs do have hormones, and are they effective as well, do you think?
I think that the medicated IUD, the one with hormones, as well as the one with copper, both seem to prevent cancer of the uterine lining, the endometrial cancer. So that is a good side effect of using those IUDs that is, I think, really not at all known and deserves to be known. But there's no evidence the IUDs have any benefit for ovarian cancer.
Right, but you get some of the benefits still from the uterus, as you mentioned.
Yeah.
So let's cover again who should not be taking the birth control pill. We talked about smokers. We talked about anyone who's had a blood clot, anyone who's at risk of a stroke. So the other side effects that I think I ought to warn everybody about are lower sex drive, mood swings, headaches, spotting, breast tenderness. You've all been warned about these things. Weight gain, I'm going to emphasize, is not one of the things we worry about. So everyone's hoping and praying that's the reason. So Dr. Westoff, if women feel these symptoms, what should they do?
Okay, well, I'm going to divide these into a couple categories. First of all, none of the things you just mentioned are actually dangerous. Okay, nothing to be fearful of. But the spotting and breast tenderness are temporary side effects that are part of your body just getting used to the pill. They usually go away all by themselves. And for some women, if it doesn't go away in a few months, try a different brand of the pill. Okay, not dangerous. Now, the other issue you mentioned is a change in sex drive. I think every woman in the room knows your sex drive changes. It goes up and down due to lots of life circumstances. And I have patients who come in and say, oh, the pill has eliminated my sex drive. I find out she's working 12 hours a day, she's going to school, she has no help at home, she has a baby. And I think it is normal to have no sex drive under those stressful circumstances. It's not your birth control pill. And the best studies do not blame the pill for changes in sex drive. It's all those other life changes.
So let me offer everybody my bottom line. And I'm hoping that some of you have thought this through carefully with me today. If you're between the ages of 35 and 50, and you've already had your kids, and you're having some other symptoms, like perimenopausal symptoms, irregular bleeding, acne, consider going on the pill again. I think it's worth looking for things that might justify it so you can get some of the benefit of being on the pill for 5 years. I've been convinced from today's show that birth control pills can help you safely reduce the chances of these cancers, especially these reproductive cancers, and it's worth keeping in the back of your mind if you think you might need them. Well, thank you all my guests. Thanks for the insights, and thanks for all the questions from the great audience. All right, when we come back, I'm busting more misconceptions that could affect your health, starting with the food label lies that make eating healthy harder than ever.